everyone, I'm Dr. Z. I'm a clinical psychologist specializing in adult transgender care. Welcome to my channel. Welcome to our Friday Q&As. This is the place where you, my dear viewers, get a chance to ask me direct and specific questions. So if you have a question for me, my email is in the description box below. All you gotta do is email me your question. I make sure I keep all of your information private and personal. I don't share your email or any names. So it's all completely autonomous. So feel free to email your questions. And as mentioned during our last Q&As, a lot of you did vote for more context. So you're welcome to email me more context, but still keep it, keep it reasonable, because if it's way too much context, it's a lot of reading. It's also hard to fit the question here for everybody to see, to read through. So we want some context for sure, but sometimes people will write me like several pages of the context. So be mindful. I would very much appreciate that. For today, I randomly selected 4 questions. As per your context request, they all have quite a bit of context. So that's why I selected 4 instead of 5, so we can take our time, go through them. I know that for a lot of you, hearing other people's histories and backgrounds is very helpful. A lot of you said that it helps you find a common thread within your own experiences. So without much further ado, timestamps are going to be below. Let's get started. First question for today. I'm socially transitioning and feel most like myself in presenting femme, but I still rely on shapewear and a mask to hide features that trigger my dysphoria. I think they're referring to the facial mask we've all been wearing during COVID. I definitely don't feel like a man, but I also don't know how far I want to go in physically transitioning. Being able to fit into the clothes I dream of wearing means a lot to me, and it's just as important to me that I can feel beautiful underneath it all. Right now, I feel ashamed of how I look without the layers, and that holds me back from my fully expressing myself or feeling comfortable in intimacy. A few months ago, I started hormones and felt an immediate sense of relief. But after a few days, I panicked. I wasn't sleeping or eating well, and the physical discomfort became too much. I'm very sensitive to feeling off, and the idea of being committed to something long-term or dealing with withdrawal if I stop makes me anxious. I want physical changes like softer facial features, breast tissue, and fat in my thighs, but I also value the energy and drive I get from testosterone. I've considered microdosing, so I worry it won't be enough to see results. I feel stuck between wanting to feel at home in my body and fearing what it might take to get there. I'd really appreciate any insight you can offer. This is a great question. I have had several clients who struggled with this. Not everybody who starts feminizing hormones feels absolutely amazing all of the time. There's people who feel amazing immediately. There's also people who feel no difference at all, and some people who feel adverse reaction to feminizing hormones. So it really depends on individuals. In this case, the question is, hey, I started feminizing hormones. I feel immediate relief. I feel immediately good. It sounds like immediately this person felt a psychological relief of dysphoria. And at the same time, there is change in terms of how they're physically feeling on hormones. They're having, struggling to sleep. They're describing that they're not eating as well. There's all this physical discomfort. On top of that, they're low in energy. So what do you do when psychologically feminizing hormones alleviates and decreases dysphoria, but physically it also shifts the way your body feels and what's happening, and it's not something that is comfortable to you? I had quite a few people struggling with this. There's a few things here to consider, and if you as a viewer have experienced anything like this, share in the comments what helped you, what kind of resolution you came to. I'm going to offer some guidelines. The first guideline is that for some people, it does takes an adjustment to adjust to feminizing hormones. Remember, you have had years and years and years, and depending on your age, you have had maybe many years navigating life while having primarily testosterone as your primary hormone. And undeniably, people do physically feel different on testosterone versus estrogen. Energy levels are different. Even sexual drive and sexual libido feels different. Sleep might be affected different. For everybody, it's very, very different. It also depends on the initial levels that they have in their body. So for my first suggestion is sometimes it takes an adjustment. Sometimes I find people are having a hard time also kind of wrapping their head around that, physically feminizing hormone is going to feel different. Might make you feel less of an energy. What I found working with my individual clients is that specifically lack of energy is very common when you go on estrogen or when you introduce testosterone blocker. What I also found is that for a lot of clients, this lack of energy was almost like initial thing to ease into, and it just took a readjustment to how your energy levels are on estrogen, and then people just kind of find their footing. It does feel different for a lot of people, but in my experience, it haven't felt so different that on feminizing hormones, you're just completely lethargic and tired, and the only way you feel like yourself is on masculizing hormones. Because keep in mind, there's cis women all over the world, including myself, who have a ton of energy. It's just different sense of what that energy feels like. That takes a little bit of readjustment. And it's not that you are not having that, like you describe, drive and energy. It's a different drive and energy. And again, it's a matter of adjustment. So that's what I first recommend. Give it a little bit of time to see if you can learn to adjust and navigate to it. Because as I say, everybody is very, very different. Sex drive is the same thing. I have clients all the time who tell me, I was expecting on feminizing hormones to have the same sex drive, where it's a lot of times very visually driven for me, or was for me in the past, and now it's very different. I notice that it takes me longer to warm up. I notice that I need more touch, or I need a little bit more something else to get myself going. All of this is natural and normal. You are on different hormones that are going to make you feel differently. So that's my first suggestion, is see if you can give it some time to adjust and be aware that it's just different. It doesn't mean that you're going to be completely without energy. Now, another option here is to discuss microdosing with your primary doctor, or to discuss a different sort of regimen where maybe you are on feminizing hormones, but I don't know if you are taking any testosterone blockers, but you are not taking testosterone blockers. There is options out there. There are definitely options out there to discuss. That's going to be another option. If trying all of this and it just feels like the way you physically found yourself feeling, again, when I say physically, I'm not talking about having the sense of dysphoria you felt, but just physically how your body physically is on testosterone. If that's still something that strongly feels comfortable for you and you just cannot achieve close to that proximity on estrogen, then that's something to also consider. Unfortunately, hormones are, I wish ideally they gave everybody what they really wish for, but it is always a balancing act. They offer something, but they tend to take away something. They offer ease of dysphoria, but they may take away perhaps how you have felt or feel. They might also, for example, for some people, not really produce physical changes as quickly as they want. It varies on so many factors, including your health, your age, and your your body's way to metabolize hormones. So that would be my suggestion. First and foremost, how long have you given it a try? Because initially that drop of energy is quite normal. I see that a lot. I'm sure that a lot of viewers can attest to that too. And it's just a matter of adjusting. Sometimes your body needs a little bit longer to readjust and just kind of regroup itself and say, oh, okay, we're getting a different hormone in our body, and just kind of almost like rewire our internal system. But I do see people adjust and just eventually, get back to themselves, and maybe it's not exactly how they were physically, but it's pretty darn close. And I think if it wasn't pretty darn close, a lot of people would be hard to stay on hormones if physically you just felt so down energetically. And in terms of sleep, also for a lot of women, introducing progesterone helps incredibly well with sleep, also helps very well with sexual drive. So that's another thing to consider with your medical provider. But this is a great question. And yeah, I think sometimes we don't talk about this enough. How feminizing hormones do help is dysphoria, but then also do have these changes that sometimes we don't really consider, that we do get invariably sleep and energy levels, maybe even appetite, that we get that some people experience. I don't want to say that it's for everybody, but some people experience on masculinizing hormone. Great question. I encourage others to comment below. Question number 2. I never despised being male. However, my persistent cross-dressing, coupled with ongoing browsing and buying of female clothing, lingerie and heels, and love of everything feminine over many years, made me realize in my late 40s that I am very likely trans femme and desire to be a woman. I had since began hormone experimentally and tentatively, but later, to my own surprise, found that I like my physical transformation, even wishing for more change. My hormones continue over the years. All of this has occurred without myself ever coming out, except to my doctors and once with a therapist. This has now gotten to the point of myself fantasizing about experiencing sex as a woman. Never would I have thought that it would come to this point. And yet, despite all this, and given my conservative upbringing in part, I keep on wondering if I'm perhaps delusional about my trans femme identity. Why do I still question it after so much? Sometimes I wonder if I should give it up. This is a great question. I'm sure so many of you will be able to resonate to this question, where you never really despised your assigned male gender. And by the way, not everybody feels a strong a sense of animosity or discomfort with their assigned gender. Some people are pretty neutral to it. Some people may be unaware that they have a lurking dysphoria underneath it. Some people might be in complete avoidance and denial in relationship to their assigned gender. So this is a great question where you don't have that negative sense of very strong physical dysphoria towards your assigned gender, but the more you stepped into the feminine, the more it starts to feel right to you. And to the point where on hormones, you're starting to now have fantasies about embodying a feminine form, something that you have never ever thought before. And so this starts making you question whether you are actually trans feminine, or are you delusional, if you should give up or you should keep going. I'm trying to... So here's the thing. First of all, it is very common for individuals, and you mentioned you are in your late 40s, for individuals later in life, especially if they have dysphoria that they've been struggling with since childhood, or have childhood dysphoria and maybe not even aware they have had it. It is very common for individuals because they got in a way accustomed or habituated to just living their life in their assigned gender, all the while there was looming dysphoria underneath. To when it starts bubbling up and the awareness bubbling up, to start question whether you are delusional or not. And the reason why you're questioning that is because you don't have a conscious awareness of dysphoria throughout decades. For people who have conscious awareness of the pain point from childhood all the way into adulthood, or from early teens into adulthood, those people seldom, in my experience, question whether they're delusional, thinking that they're trans femme, because they have lived and experienced pain point for so long, right? You cannot disregard a fact. Decades of living with dysphoria is just becomes a factual information for a lot of you at some point. When you don't have that, and suddenly you act cracked and things just coming out of nowhere, I think majority of people would stop and ask themselves, am I making this up? I think that's I don't think that's necessarily a silly question to ask oneself, because it can be so sudden, the onset can be so sudden, the act crack and the realization can be so coming out of nowhere. It does feels like your world has been spun upside down. I seldom see people where it is, if again I work with adults, majority of my clients are high functioning adults who may have other struggles, challenges, but overall I almost never see an adult who is genuinely, this is what would we clinically fall into a delusion. What I see is individuals are having an inkling sense inside that this is what's going on, but they have a hard time really accepting it. And when we start talking and we start looking at their history, and we start looking especially now at their relationship to their assigned gender, and most importantly, how do they feel right now when they are feminizing? What is it about feminizing that feels right and aligned to them? Very quickly, people start realizing that this is very far from delusion. This is, in fact, their identity talking loud and clear. I always encourage, if somebody genuinely thinks, could it be something that my mind making up? It's going to be always worth your while to go see a specialist or a gender therapist in your area and just rule it out if that's genuinely concerned. What I have seen is that for a lot of adults, it's more, it's almost like not really genuine concern. Am I losing my mind here? Am I really making this up? But more like that's what it feels like, because I'm having a hard time wrapping my head around it. So for you, if this is a genuine, if you're really concerned and you're losing sleep over it, I would recommend just go see somebody, rule it out, get a peace of mind. I have a lot of people who come to me, they just want to rule it out. And, I think that can be very helpful in at least moving forward, because then you're open up to just accepting it and then figuring out for yourself what you want to do about it. But I just want to say it is so incredibly common, so common for adults, especially for those who suddenly had realizations or had a cross-dressing history of behavior, and then the cross-dressing behavior starts to slip into trans identity, to start wonder, am I just making this up? Okay? Remember, for adults, for a lot of individuals who already have prefrontal cortex developed, that's a part of your brain that is able to foresee the consequences of your decision making, for your mind to make something this up, I think it's really far-fetched. Here's why. A lot of adults, especially older adults, a lot of you have a full conscious awareness and comprehension of challenges that arise with stepping into trans identity and also navigating transition. I have yet to meet an adult, especially older adult, that was so excited to start transition. In fact, I think I said this on the channel, if I see somebody who's just so excited and not even acknowledging any challenges, to me it's a red flag. 99% of adults I see always come to me with the same thing. Is this really what I think is going on? And oh my God, I'm terrified that the only way forward is this way forward. And I'm so scared of everything that's going to come with it. Because as an adult, I understand not everybody might accept it. I understand there might be challenges. I can see how much testosterone damage has done on me. I wonder now if hormones are even going to feminize me enough. Will society accept me? All of these things. And because a lot of you know and realize all of the things, think about it. Who would just come up with this idea that, I just want to easily step into this, in the embodiment or into trans femme identity? People step into the identity because that's who they are. Because that's a constant magnetic pull, because that's your authentic inner self. So I think that's important to realize too. Is that, it's like I had a client who said, Dr.Z, there was a time when I thought that maybe I'm making this up, but then I thought to myself, oh my God, why would I make this up? Why? It sounds like so many challenges come with it. Why would I make this up? It's easier to make up other things maybe in our lives as adults to justify things. We do rationalizations all the time. Why should I buy a particular something, even though I don't really need it, but I'm going to come up with reasons why I need it, I'm going to justify it, and I'm going to get it. That's very different from coming up with something like this. So like I said, for somebody to be delusional about their trans femme identity as older adults, in my experience, incredibly rare. Does this happen? Of course it happens. Everything happens. Everything is possibility. So if this is keeping you up at night, go see somebody and just rule it out. And get yourself peace of mind. I think that's going to be very important. But know that so many people, they're like, because it's so quickly, the egg cracking can happen so quickly that you have no choice but to sit there and wonder, oh my God, am I just losing my mind? It can feel like you're losing your mind. And a lot of people are not losing their mind. It's very quick. It's a shift, and it takes a while for mind to adjust. But I encourage others to comment below and share your insights on this as well. And if you've been there, most importantly. Great question. Okay, question number 3. After many years of loving things feminine and persistent cross-dressings that did not want to go away, I realized that I actually wish to be a woman, and so went on to hormones in my late 40s. I never came out as being trans femme and on hormones except my doctors and once off session with a therapist. My personal circumstances compels me not to come out, too much risk, but I have been able to manage my secret for quite some time. I often use opportunity to secretly go out trans femme publicly and to express my inner feminine. I think that I essentially pass as female when dressed up. I take photos of my female self and look quite attractive in my own view. I often receive expressions of admiration and had approaches from males during these outings. I am, however, dead scared of being potentially discovered as a trans or a fake, which inhibits the liberty of my expression and makes me keep a low profile. How can I navigate this fear? Again, such a relevant and important question. So here's a question of somebody who is starting to acknowledge and step into their trans femme identity socially without fully coming out, other than to their therapist and their doctor, are socially have been out there presenting as themselves and feels like they've been gendered the way they see themselves, and even gotten admiration and praises from males and other individuals and outings, which can feel to a lot of women with trans history incredibly validating. I have to make this video actually about the validation and how good it feels from specifically male gaze, which is also very culturally kind of enforced, but yes, I'll make a video about that. So the question is, the more you're feeling that, I pass, I'm seen as a woman and it feels amazing and wonderful. Now you're starting to feel this fear, like, oh my God, what if somebody's gonna out me? What if somebody's gonna discover that I'm trans, or call me fake or imposter? And as a result of this fear, it starts to shut you down and inhibit your ability to just go out there and be completely yourself. This is very, very common. And so one of the things I'm going to say is we live in a world that is quite unsafe for trans folks. If you are genuinely live in a part of the world, in a part of environment where it is actually physically unsafe for you, safety is always, always, always first. If you live in a world where you don't think your physical safety is at risk, it's more that you are being mindful and worried about your mental space and not being in a position where somebody says something and how you're going to take it, but also fear how somebody might respond if they find out that you are a woman with transgender history. I see this fear that starts to inhibit and preventing people from just living their life and being themselves. Oftentimes, that comes from this very strong, almost borderline suffocating parameters some women with trans history create for themselves, where those parameters are, I'm going to be seen as a woman and only as a woman. And when I say I'm going to be seen as a woman, meaning I'm going to be seen as a cis woman. In other words, there's no way I can be seen as somebody that is transgender. And this type of rigid parameters, in my experience as a psychologist, is an illustration that there is a resistance to accept that you are a woman, undeniably, but you are not a woman with cisgender history. You are a woman with transgender history, and there's nothing wrong with that. And your history, your transgender history, has a ton of overlap with my cisgender history. But there's certain elements too that are different. It doesn't make you any less of a woman, just like it doesn't make me any less of a woman. And I think that's the challenge I see, is that when women don't accept that, and I've seen and I've worked with clients who tell me point blank, I want to cis pass. And I'm sorry, my friends, if this is hard pill to swallow, but what is it, cis pass? Like, I get it that a lot of women want to pass because not only does it make you feel safe, but it also makes you feel valid, makes you feel like you belong. That is all super, super important. But there's a difference between wanting to pass and equally, alongside wanting to pass, holding on that you accepted and you're okay being a woman with transgender history, versus going out there and being hypervigilant, highly anxious, and incredibly stressed out and terrified that if anybody finds out you have trans history, that something is going to happen to you, that the whole world is going to crumble, that everything that you think you are is going to fall. Do you see what I'm saying? Do you see the difference there? So it's really, really important to, work on the things you are carrying, such as if somebody's going to potentially discover that I'm trans, they're going to think I'm fake. They're going to think I'm lesser than. It's very important not to internalize and not to take on other people's views. Look, people are always going to judge all of us. going to judge you whether you're going to accept your trans history, whether you're not going to accept your trans history, whether you're going to try to cis pass, whether you're not going to try to pass at all. Whether, it doesn't matter. You can do everything by the book, and there's always going to be somebody who's going to judge you. You can't always internalize other people's opinions, because if you do, you're now constantly living out your life, pretending to be something you're not, because you're constantly trying to feed a person that is okay for everybody else. But you have to be okay with yourself. So with this question, how do I navigate this fear, is to first ask yourself to what extent you have accepted that you have a trans history, and what is it about it that doesn't sit right with you. So if you do go out and you feel incredible and you're radiating and you're getting all this attention, and then if somebody says, oh, are you transgender? Just think about that scenario. What feelings does it bring up? Does it bring up fear and anxieties that, oh my God, somehow I don't pass or whatnot? What brings up it is in you? Everybody has different things that it brings up. How can you get to the point where if that happens, can you just acknowledge and own it and say, yes, I am. So I think it's really, really important. Acceptance is a huge component of internal part of transition. Without it, this is where I see the number one root cause of imposter syndrome in so many individuals, on top of that of society and the world. So that's just something to think about, and I encourage you to think about as well. Encourage everybody else to also share your thoughts on this, because this is a common one. I think a lot of women struggle with this. I think part of it is not even your struggle. Part of it is you've been so bombarded by not only culture and society on how to be, but also by trans community. It's hard to own who you are. Very hard. Very, very good question. And yeah, I wish you all of the best. And finally, our last question number 4. I am assigned male at birth and started dressing in my mom's clothes, apparently from the age of 2. As a young boy, I would often think that I wanted to be a girl. I was effeminate and often told to stop certain feminine behaviors. I dressed because I felt compelled to do it and loved the feeling it gave me. A wholeness of sorts. Once puberty set in, it became more sexual, but I still imagine being female, and I absolutely love to be as feminine as I could be in private. I got married, I didn't tell her about my dressing, and had 2 kids, now adults. My wife discovered my secret, and it was hard for her, more of a trust issue, understandably. Years since, she's okay with my dressing over time. Jumping ahead. Over time, I believe the best description of who I am is genderfluid. I'm okay with my male self more or less, but when presenting as a woman, I feel truly complete and absolutely love who I am. I have no desire for gender reassignment, especially at my age, but I wouldn't mind full facial hair removal and low dose of hormones. My question is, how do I come out to friends and family as someone who enjoys fluidity in my gender and still wanting to be more female than male? Oh, my friend, this is a really good question, and it's quite a simple one. As I always say, regardless of who you have to come out to, friends, family, children, it's just a matter of having conversation. It really is just a matter of sitting down and saying exactly what you just said, maybe without additional details, depending on how much you want to share, but really saying that with your evolution of life, you have discovered that you have much more fluidity to gender, and within that fluidity, female identity feels even more aligned to you than male identity, but you still feel comfortable in male identity nonetheless. And that sometimes you do like to express yourself more feminine, whether it is in clothing or maybe in other ways, whatever it is you connect to in a sense of femininity. And that is it. Your friends and family might have questions. They might ask you what that means. They might not even understand. That's okay. And it's also okay to say you don't know. People might ask you, does it mean you're going to become a woman? You can say, I don't know. People can ask you, does it mean you're going to have start hormones? You can say you don't know, because part of you wants to maybe start low dose hormones and do hair removal, but you're not really sure yet. So you don't have to have all of the answers. When we come out to people in our lives, it's so important to remember that it's okay not to have all of the answers. And it's also okay to remember that people are going to have questions, especially if they are your family. I don't know about you, I'm Russian. My family is super nosy. I have two sisters, and my mom. Try to call one of my sisters and tell her something about my personal life in secret. And I guarantee you, if I tell her, don't tell mom and my other sister, how much you want to bet that they will know by the end of the day? Families are all different. Some families are very close and very into each other's business. Some are not so much, but there's still an end. You're coming out to people you care about because I'm assuming they care about you. When people care about us, they're going to have questions, okay? That's all just normal and natural. And it's also, like I said, completely okay for you not to have answers and to say you're trying to navigate as it comes. You're not rushing into things. You're exploring things and you're trying to navigate them. So that's how I would, and I would just say that I'm gender fluid and I am comfortable with both sides. And if you plan to present more femme in front of them in the future, just tell them. So in the future, when you see me sometimes presenting more femme, you know that I am in that particular time frame at the day more comfortable in that element. And if you have maybe a feminine name that you would like to go by, you can introduce it as well. But yeah, there is, coming out is just having a conversation, having heart-to-heart open conversation. So yeah, I really hope you will have that conversation with your side of the family. And I think it's wonderful you already came out to, or you said your wife discovered your secret, but it sounds like your wife is supportive, which is wonderful. And it sounds like your next step is to be closer to your family by sharing this about yourself. And I encourage you to do that. I do. Like I said, just have a heart-to-heart conversation. Great question. These are really, really good questions. As you can see, the context is getting bigger, which is okay. So if you do have question for me, feel free to email it below. My email is below in the description box. And I'll put all of the questions in a folder and randomly select four for our next Q&A until I go through the folder and we run out of the question. Having said that, comment below, share your input, share your ideas. I think everybody really benefits from the comment section and from hearing what others have to share from their experiences. I also love reading all of your comments, and I will see you next time. Goodbye.